just to piggyback on what Lynn just said, when I do prostate screenings with men, of course, I'm told constantly, oh, we didn't know you did that. We thought you were all about WIC and STDs. They know about those two things. So when I health educate, not only do I health educate on tobacco and prostate. At one time we had over 29 programs here. I don't know how many we have now. But I health educate on everything that I'm dealing with at the moment. If it's a service we can provide, I let them know. And let me just back up a little bit and say that we encourage WashU's interest in volunteering with Eastside Health District and with the East St. Louis community. There is much work to be done here, and we've got to go miles before we sleep, so to speak. So come on down and join us. We have a teaching garden that our director is a fierce proponent of, and it is open to the community, and hopefully we can get into the classrooms. And because we are a culture who enjoyed eating all of the wrong things, and when you don't know, and you don't know that you don't know, you are a product of your environment. So there's a trickle and a ripple effect. So a lot of the females don't know how to cook. Now we're getting into an era where you can pop open a can and stick it in the microwave, or it's easier to drive through McDonald's. So now you've got obesity issues. We also, we have hunger issues here. A lot of our school-age children don't get the meals they need. That turns into lack of nutrition. So we've got a lot of obstacles, yet we remain hopeful, and we encourage you. East St. Louis used to be a thriving community. A lot of people, my parents, migrated here from the South because of the ability to get a good job and earn a decent living for your family. I was educated in the public school systems of East St. Louis. I got an excellent public school education. You may find that hard to believe if you listen to Channel 2, 4, and 5. A lot of the residents are graduates of your institution. So we have a lot of good people here. We have a lot of residents who refuse to leave because their heart and their soul is here in the city. All of us are here because we care. You're not going to get rich doing this. I'll be the first to admit that. You've got to love it. You've got to be committed. And if you are willing to interview, to get the information you need to encourage others, that lets us know that you're committed as well.